what credentials do individuals need to be able to practice as a health coach?
Well, that's an interesting question, given that there technically is none. There are in a very mixed field that we're in. People out there that take anywhere from a one-weekend class to a 3-year master's program all can call themselves health coaches. So to that end, I'm involved with an organization that's worked very hard for the last 8 years to bring some standards to credentialing for individuals so that we can kind of clean up that mess that's in the field. So the organization is the International Consortium for Health and Wellness Coaches. We currently have a national board examination that is offered twice a year. Graduates of approved programs, which include University of Minnesota, can sit that examination once they've completed a certain minimal amount of their education, and also have a practice log that's documented at least 50 sessions of practice. For our students, they're eligible to sit for that national board exam once they've completed the 20 credits of work that would be in the certificate. So at the same time that certificate students qualify at the end, the master's students, when they're at that point, i.e. they've finished their internship, and if they have a sufficient practice log, they can actually sit the national board exam before completing their master's degree. Students often ask, do they need to get a license in health coaching as well? And currently, licensing is very much an economic and a political issue. It's also an issue driven by volume. So until there's a high enough volume of providers in any given state, no state government will provide a licensing office process to license somebody. And it really is more about the money, honestly, than about the competencies. So at this point in the professional development, I don't anticipate licensing becoming an issue in any given state for probably another 5 to 8 years. And most states will build their licensing requirements based upon what the national board certification requirements are. So any of our students or graduates who have taken the national board exam and passed that successfully, once a licensing process goes into place, they'll be well positioned to be able to be licensed. Otherwise, currently in the state of Minnesota, they practice underneath the umbrella of the Unlicensed Provider Bill, which provides them a legally safe mechanism to provide care services to an individual without having a state license.
So the testing you talked about, do I have to go to another state to take it, or can I take it in my hometown?
The test is offered at about 200 to 250 different testing centers around the country. We're fortunate enough to have several centers around the Twin Cities. So if you live here, no, you wouldn't have to travel. You just tell them where you live, and there's about a 3-week window when the test is offered, and they assign you a testing site that's closest to your home. If you happen to be an out-of-state student that's traveling here from a distance, and say you live in rural Montana, you may need to travel a couple hundred miles to get to a testing site. But if you're in any significant urban area at all, there'll be a testing site in the urban area where you are.